we have something that I love to do is the Board of Health Champion Awards, and we have 2 champions to recognize. Susan, do you want to do that?
Yeah, I'd like to propose, if it's okay with Ted Colas, that we recognize him at another meeting.
Okay.
Because this is, we recognize the homebound operation that, I don't know if you remember, you probably do, but in the policy meeting, you had the great idea of the concept of the homebound program, and we recognized other colleagues with the fire department, with MRC, and some of our staff last time. But in light of just the time, and I do want to get to the executive session and hear the very valuable feedback from board members and also legal. So if you're okay, could we push that to the next meeting?
Sure, consider me recognized.
Well,
The suspense is killing us, but let's wait until our next meeting.
Yeah, and so we'll catch that up, but we do have some partners, members of our community that I would like to move forward with a recognition of public health champions, if that's okay. These days and these meetings are such a jam-packed meeting, and they're all priorities, and we want to get to, but thank you for your grace and having us push that back. So let's go ahead and have Leticia, Leti, Aranda, come up, please. And we are recognizing Leti Aranda for her willingness to volunteer at many of the points of dispensing. And you can stand right there.
Welcome.
Thank you for being here. She helped us out at many of the points of dispensing we held at the South Building. Leti first started as a promotora, working with partners in southeastern El Paso County community to hold an equity points of dispensing that was designed specifically with our Spanish-speaking community members. She saw the need to continue to support the pods by providing bilingual services. We even tried to have Leti register with Goodwill Staffing, and that's the way that we're able to pay volunteers. However, with that staffing agency who was supplying, many of our staff members, but she declined and stayed really a true unpaid true volunteer. Her support in our vaccination efforts and to the entire community is so appreciated, and you are a true public health champion. I know that you reached out to our emergency preparedness and response manager, Lisa Powell, to really get involved, and you're caring about the community and helping us with vaccinations. I think it's so important. With what we've learned also is that to have that contact and your trust within your community to be able to support us also in being successful in providing vaccinations. So we want to recognize you as a public champion, and we are so appreciative of you and your time, and we hope to continue keeping in touch and working with you, because we have the 5 to 11-year-olds to vaccinate, and we're gearing up for that the 5th, the 6th, the 7th, and so that's the weekend at the South Building. But thank you so much, and I've seen you, and I know the work that you've done, and our other partners too. I see Lisa here, but you are a true public health champion, so thank you so much. Take a photo with Board of Health, but I also want to give you an opportunity if you want to say anything.
¿Quieres decir algo y yo te traduzco?
Sí, solo quiero.
I will translate for her.
Okay. Thank you.
Quiero como dar las gracias porque están dando la oportunidad a toda la comunidad hispana a que se acerque a nuestro idioma, ayudarles para que ellos también puedan vacunarse.
I just want to say thank you because you're giving the opportunity for the Latino community to approach public health, and for me it's a pleasure to help everyone in the Latino community and talk about public health.
Sí, de que hablamos el mismo idioma y que ellos se sienten como con más confianza acercarse cuando uno le habla al mismo lenguaje de ellos.
Because she really appreciate that you guys think that we speak Spanish, and when in your clinics, you bring people who are bilingual, bicultural. She really appreciate this because we're all one.
Lisa, can you stand over there too while you're talking so I can take a photo of you?
Oh, sure, I love taking pictures.
I'm over here too. Notice, and because we've worked a lot with Lisa as well.
Yeah.
And we can't do our work and serve in our community without you. And it's really a true partnership. So, it's a symbiotic relationship. We need you, you need us.
Yes, we all need each other. Amen, sister. But today it's about Leti. I just want to say a little bit about Leti because she's very humble. I'm not. So I like attention somehow. My promotora here, or promotora, you have had for the past 22 years gold in here. You have a team of people that wants to serve. They just didn't know how. So my job as a community leader, as a community advocate, is to get all of them together, see their skills, and then partner public health systems, maybe government systems, bring the community. We all feel safe. We all feel welcome with you guys. Thank you very much. I want my community to know that public health exists and what you guys do and all the work that you guys do. And some of my people don't understand because they just don't speak the language. They have language isolation, status isolation, but having community leaders, government and community leaders together, then we transform communities. And that's what Leti has been doing for the past 20-something years. This woman, we organized a clinic in less than 2 weeks, and we brought more than 1,000 people with you guys to get vaccinated in less than 2 weeks. This lady mobilized communities. Me, I'm just the face of, I don't know. I just love being the face of everything. So I don't know, No, I do a lot of work. I have a lot of passion. I have always been committed for 22 years with my community. So, but today's about Leti.
Thank you.
Yes.
Okay, this is a photo op, and I think, how do you want to organize?
Could I
Oh,
just
yes,
say
please.
one word? I wanted to just also share that after we had the clinics where we had 1,000 people come, we had to do a second clinic. And one of the most important things that Leti did was she came back and she encouraged those people to come back to our clinic, even though it wasn't all the promotoras there anymore. And then we had about 150 people left on the list who we didn't know whether they had gotten their second vaccine. They didn't come back to our clinic. And Leti took that list and she called every single person on that list, 150 people herself.
Wow.
She called them and encouraged them to come in. Many of them were afraid to come back because they didn't know if they would have someone there to speak their language, or they felt like they had missed their appointment time and they didn't know if they could still come. And she encouraged them to come and get their vaccines. So it was important work. Thank you.
Well done.
Yeah, Leti.
And we're going to be giving her a coin. You and law enforcement or fire know what this is, but emergency preparedness and response. And it's, I believe, a tradition. So then
There you
just
go.
shake your hand.
Just right. There you go.
That's for you, and we'll, you can put it in there, or you can display it wherever you want. And then this is your public health champion.
Oh, thank you.
And we'll go over here and take a photo.
Oh, yes, thank you.
There we go. Michelle, you organize this.
We'll have
Okay.
Leti in the middle. Probably move some of this stuff out just so it's not in the
We gotta make this challenge.
No. You did the work. You did the work. Stand in the middle. And then in the middle? Okay.
No, you're fine. No. Today it's all about you, Leti.
Now, we'll take a picture later.
Well, it's all about you today, Leti.
Okay.
I take lots of pictures all the time.
Say smile in Spanish.
Smile. Sonrisa.
Okay, we'll take several here.
Sonrían.
Sorry.
Bonitos todos, guapos. Wow, Leti, you look so wonderful.
I think we're good. Thank you, everyone.
Okay.